So it seems the time that we should start our sessions. And we have the first talk from Stefan from which is policies, practices, and their impact of quality of life of people with rare diseases. So this is a talk which is going to be given by the members of the Society for Patients and people who suffer from rare disease. Stefan, please take your stand.
Thank you, Professor. Ladies and gentlemen, good morning. I am Stefan from the Center for Regional Policy Research and Cooperation Studio. Today I am going to present to you a research study that we have conducted on policies, practices, and their impact on the quality of life of people with rare diseases. But firstly, I would like to address the uniqueness of the rare diseases. They are chronic, complex, life-threatening conditions that quicken and permanently disabling the organism. They can attack multiple organs or system of organs. Their frequency can be of 1 per 15,000 people, for example, cystic fibrosis and hemophilia, to 1 per million, for example, the syndrome of this trigonocephaly. Globally speaking, there are between 5,000 and 8,000 rare diseases, most of them with a genetic etiology. The term rare diseases encompasses a wide range of possible clinical conditions that represent a challenge for the people with rare diseases, those who care for them, and the health practitioners as well. Rare diseases are a global issue, a global challenge. On this infographic, you can see the population of the continents in the world. For example, if we take Europe, the population is nearly 738.5 million. According to the European Union, 6 to 8% of the population in Europe are people that are affected by some rare disease, which means that between 27 and 36 million people suffer from the struggle of rare diseases in Europe. Globally, the estimate is 350 million people that are affected by some rare disease. The study that I want to present to you, the goals of the study are to contribute to bringing evidence into policy making on rare diseases in the country, and to contribute to bringing informed policy into practice and help improve the situation of people with rare diseases here in the country. The study objectives are to compare policies and legal instruments, to understand the experiences and practices of the respondent groups, and to describe if and how rare diseases affect the quality of life of people with rare diseases. For the purpose of this study, we used a mixed methodological approach from quantitative and qualitative methodology. We gathered two sources of data, primary and secondary information. The primary information was gathered through surveys and semi-structured interviews, and the secondary information was gathered from reports, online resources, and other literature. There are three groups of respondents for this study: the people with rare diseases, parents of children with rare diseases, and health professionals as well. This methodology was based on several principles such as objectivity, universality, dialogue, exchange, and change. In this study, you can also see the comparative analysis of selected countries in Southeastern Europe, such as Bulgaria, Slovenia, Croatia, and Serbia. The criteria for selection were the geographical position, the similarity of the health systems, and the special focus on rare diseases. There are many challenges that are affiliated with rare diseases. We've chosen to present these three: diagnosing, treatment, and providing better quality of life for people with rare diseases as of key interest for the respondent groups. Regarding the diagnosing, the first challenge is misdiagnosis. Almost 50% of the respondents had experience with such a challenge. The second one is absence of and delayed definitive diagnosis, which means that these people will have to live with their symptoms without definitive diagnosis, which means that they cannot get treatment and therapy. Also, there are cases that have consulted up to 10 doctors to get a definitive diagnosis, which can take many weeks, months, or even years. Regarding the treatment, there is the untimely and inadequate treatment, treating misdiagnosis and unavailable medicines, medical devices, and therapy. For providing better quality of life for people with rare disease, we have to improve in other areas as well, such as policies and legislation, health statistics, human resources in health and other sectors as well, and health and other sectors should facilitate integration into the society. The first national program for rare diseases in the country was adopted in 2009 with the objective to raise awareness and strengthen the expertise to reach the level of member states and of the EU. Regarding the information and data in our country, there is insufficient epidemiological data on rare diseases. As I said earlier, according to the European Union, 6 to 8% of the population in Europe is affected by some rare disease. If you extrapolate this number even in the most conservative view of 6% of the population, then in Macedonia it is assumed that there are about 120,000 patients with rare diseases, 6% of the population. The registry was established in 2015, but this registry is still not properly regulated. Regarding the activism and support, the National Alliance for Rare Disease in Macedonia was formed in 2014 with priority to prepare a national plan strategy for rare diseases in the country. Their membership counts 13 organizations, and these organizations cover more than 50 rare diseases. We also should not forget the civil society impact, which is a key driver for putting rare diseases into the focus of public policy and their implementation, especially in health and social care. Also, these associations are the everyday link between the people with rare diseases and the systemic response, or they're true representative in front of the institutions. Regarding the quality of life for people with rare diseases, we've measured through many aspects, many criteria, such as social life, psychological aspects of life, self-perception, attitude towards the disease, the communication and relationships with their family, friends, close ones, and so on. But for this presentation, I will present to you three aspects of their quality of life. Their social life, their psychological aspects of life, and their self-perception. Regarding the social life, as you can see, there are many respondents that have stated that they have someone to talk to, and they have open personality and they are open to communication with other people. But there are some that are feeling lonely, they're introvert, and they're not so open to communication. The most striking thing here for me was in the relationship area, that the majority of the respondents stated that they haven't decided, or they don't know if there is someone to go to for help, or if they have people that are close to them, which is very struggling. Regarding the psychological aspects of life, on this slide you can see that the majority of the respondents stated that sometimes they're in a bad mood for no reason, because of the disease, because of their state, because of their symptoms. Sometimes they are too tense or nervous because they cannot do the activities with their friends and family as they want to. And the most striking here in the psychological aspects of life, for me, is that almost 30% of the people with rare diseases stated that nothing brings them pleasure. And they have a feeling that everything is hopeless, which is astonishing. Regarding the self-perception, on this infographic you can see a case study that we've made in this research study. We've compared the most negative self-perception and the most positive self-perception of the people with rare disease. Those who have negative self-perception showed signs of mood swings, of a feeling of loneliness, feeling of hopelessness, dissatisfaction with oneself, and so on. On the other hand, those who had positive self-perception and who showed signs of communicative personality, satisfaction with social life, satisfaction with the fulfillment of their everyday activities, daily activities, and hope for change for the better. Both cases are people with rare disease. The choice of how to deal with and feel is personal. And at the end, there are the 5 policy recommendations that were supported by the 3 groups of respondents. First, the support, besides financial, medical, social, and psychological. raising awareness and professional knowledge of the practitioners and the general public, professional collaboration and partnerships for diagnosis, registration, monitoring, treatment and research for rare diseases, improving the legal environment in the area and initiating policy dialogue based on evidence, and integrated approach for detection, diagnosis, prevention and social intervention for people with rare diseases, their families and carers. And at the end, one message, one little bit different. Thank you for your attention. Here is the reference.